Well, hi guys, I hope your week is going well. Today I'm going to talk all about spider veins on the legs, or varicose veins. I get several questions about these. I got many questions about what can be done about spider veins on the legs after my broken blood vessels on the face video. I also think I mentioned varicose veins in my pregnancy skincare videos, and so I got many questions. Well, what exactly can be done to get rid of those? So in today's video, I thought I would talk all about what varicose veins on the legs are, why they occur, and what can be done to get rid of them. Nobody enjoys them, and for many people who develop them, they can be a source of incredible frustration, and they can really make people feel incredibly self-conscious and kind of embarrassed to wear shorts or go to the beach and wear a bathing suit, and they want to pursue a cosmetic treatment to get rid of them. So hopefully this video will be helpful to you. If you're new here, welcome. My name is Andrea. I'm a dermatologist, and my YouTube channel has fun vlogs of my life, as well as a lot of plant-based recipes and skincare Q&As and skincare content. So if that type of thing is of interest to you, then subscribe for more. In order to keep blood flowing in the right direction, our veins have these little valve leaflets in them, okay? And those function to prevent the blood from backflowing and keep it going in the right direction back up to our heart and away from our legs. And that's a pretty big feat for these little tiny leaflets, okay? And so they're not indestructible, and their lifespan is not indefinite. They give out, and unfortunately, there's not a TaskRabbit we can call to come in and repair them, okay? It's not like when our plumbing goes out, or there's a little mechanism in our stove that needs replacing, a bulb. It's not like that, okay? I mean, once they're kind of shot, they're sort of shot. And the reason they get shoddy over time is because of things like prolonged standing that puts a lot of pressure just down on the lower legs and really asks the veins to kind of do a lot more. States like being pregnant, where you have a lot more internal pressure going on, a lot more fluid built up, really can put those veins and valves under a lot more stress. That's one reason why varicose veins can become more prominent during and around pregnancy. And additionally, some of the hormonal factors with pregnancy, sometimes with birth control pills, can also influence the development of these little nuisance varicose veins and spider veins as well. It all has to do with affecting the valves in our legs, okay? And so once those valves are a little shoddy and not properly functioning, the blood backflows and kind of builds up in there and dilates the blood vessel and dilates the vein. Little veins offshoot and become dilated. Those little offshoots are visible to the eye on the surface of the skin, and that's what results in the varicose veins and spider veins that are cosmetically unappealing to many individuals. But like most things that we don't like about ourselves, we can blame our genetics for developing them. There's probably some sort of underlying genetic component as well as to why people get them. Also, a history of any kind of trauma or injury in the leg can predispose to developing them. Anything that crushes the leg can just, mechanically speaking, impair the valves and lend itself to the development of spider veins and varicose veins. People who are in professions or occupations, or their lifestyle is such where they're either on their feet all day, standing, and not necessarily moving around, okay? So they may be standing but not super active, and or they may be in a more sedentary profession where they're sitting all day, and this results in just blood kind of hanging out down in the lower extremities, in the legs and feet. And it's a huge task for our cardiovascular system to get all of that blood always back up to our heart. So it kind of hangs out there. And so the longer you're on your feet, the longer that you're sedentary and sitting down in the direction of blood flow, just by gravitationally speaking, favors their development. People who are a little bit more active, who do things like biking, exercising, the muscle contraction of the muscles around the veins in our legs. The muscles in our legs are quite large, and so the contraction of muscles around our legs, excuse me, can actually help to get that blood back up to our heart. So that can really help. So not being sedentary, not being kind of confined in one position for a long period of time really helps get that blood flow back up to the heart and prevent them from forming. There are some things, however, though, that you, an individual, can do to prevent them from forming. And one thing is, if you work in a profession where you stand for a prolonged period of time, or you are sedentary, one thing that you can do is to wear compression stockings. I would advocate that you first check with your treating healthcare physician. There are a few medical conditions in which wearing compression stockings can be contraindicated, so make sure that's not you. Check with them first. It would be pretty obvious to them, or they could send you for a special ultrasound test to make sure that compression stockings were okay for you. But in otherwise healthy young adults, for the most part, compression stockings are more than safe, but do check with them first. But wearing compression stockings can help quite a bit because it functions to squeeze that tissue for you and get that blood going back up to your heart. They are very uncomfortable to wear. Personally, I wear them and I have come to love them, and I don't like going without them, okay? But they're very, very uncomfortable. They're very difficult to put on as well, okay? And so at the end of the video, I can give you some tips and tricks about compression stockings that will be helpful, hopefully helpful to you, but that is something that can be done as a preventative measure. What can be done, however, once they develop as far as procedures and interventions, what can a doctor do? Well, one of the things, dermatologists actually treat these a fair amount, and one of the first things that usually is done is that you are sent for an ultrasound test to look at the veins, make sure there aren't any veins deeper down that are contributing to the problem, make sure there aren't any blood clots in your legs. And once all of that has been properly evaluated, then one option is for the little tiny spider veins, okay, not the big dilated varicose veins, but the tiny spider veins, sometimes pulse dye laser, the same laser that I talked about in my laser video and in a lot of my rosacea videos, a laser that is basically used for targeting redness, dilated blood vessels. It actually can be helpful for the little tiny small veins as well, the spider veins. But it's not very useful for the bigger veins, okay, because they're too large to be effectively targeted by the laser, and so laser isn't particularly useful for those bigger dilated ones, but it can help a little bit with some of the smaller spider veins. And sclerotherapy in reality actually sounds kind of disturbing, but it can be quite effective. It involves injection of a little bit of saline, or basically salt, sodium chloride, or actually a detergent into the vein. I know that sounds terrifying, but what this ends up doing is it basically creates a localized irritation inside that vein, okay, inside that little vein exclusively. Causes irritation and basically makes a little bit of inflammation, and that dilated abnormal vein scars down, fibroses down, and then later is resorbed by the body and goes away, okay? So it can be quite helpful. It sounds scary though, the idea of injecting detergent into your body, but it's been used for many, many years, and it can be very helpful, and something that I've done before, and dermatologists elsewhere do. It's a very common procedure and can be very helpful. But I'm not going to beat around the bush. I think that sclerotherapy is incredibly painful. I tried it on one vein just myself to see what it was like when I was a resident and we were learning how to do this. And I thought it was pretty painful just to try it out. And so, everybody is variable on their pain tolerance, but I would say just on average, on a scale of 1 to 10, 10 being like the most severe agonizing pain of your life and 1 being like nothing. It falls somewhere in the middle of 5 to 6, but I found it more along the lines of 6, and I have a pretty high pain threshold. I thought it was uncomfortable, but and too uncomfortable for me to really care to continue doing. I was glad to have the experience of seeing what it felt like, but I don't think it was enough for me to want to continue doing it, but many people love it and are not bothered by the pain at all. After you have sclerotherapy, one thing that you should know before going into it, however, is that after you have sclerotherapy, you've got to wear, I mentioned the compression stockings, you've got to wear them like, you know, at least all day, if not, you know, on an ongoing basis for a week. So if you hate the compression stockings and it's the middle of summer, I mean, this may not be the time to do it, okay? Compression stockings are hard, like I said, are hard to put on. They, you know, can feel uncomfortable. They're very hot. Here in August in Houston, I would not want to be pursuing sclerotherapy and having to wear compression stockings around the clock for a week. You cannot exercise for about a week after the procedure either, and so be prepared for that. You know, don't get this done the week before you're going to go do some triathlon or competition or something. You're going to have to just be chill and not do any exercise for a week after the procedure. One of the more common side effects that you can also develop is post-inflammatory hyperpigmentation, kind of a stain where the blood vessel is treated. And the reason that it occurs is, if you think about it, you've just destroyed a vein that had all of this blood pooled in it, and that blood now kind of has to degrade, and the body degrades it. It gets absorbed by the body, cleared by your immune system. It goes away, but that discoloration, that stain, that's really what that is, okay? Usually it takes up to 5 treatments. So, you know, when I tried it on that one little vein to see what it felt like, I was like, I don't need to keep going with this, thanks. But it takes up to 5 treatments. And the thing is, you know, it will help to get rid of the little spider veins for sure, but it doesn't stop more from forming, and it can't necessarily get rid of all of them. Okay, so at best you will see about anywhere from, like, you know, I would say 60 to 90% clearance of the spider veins and improvement, and that can be pretty tremendous for some and not satisfactory for others. So you can see how it's individualized as to who's going to be happy with the results, but that's kind of what you can expect. But like I said, sclerotherapy is really only useful and indicated for the spider veins. It's not helpful for the larger varicose veins. What can be done for those? Well, you know, it used to be that the only thing that could be done was vascular surgery. And so a vascular surgeon would go in and basically just cut out the vein. And so it's a fairly invasive procedure. But really bad varicose veins, depending on their size and depth, they can compromise blood flow in the area. They can lead to chronic swelling in the legs. It can almost be a health hazard. So, you know, sometimes it's indicated, it's medically necessary to have them removed. But, you know, for cosmetic reasons, it's another reason to have them removed as well. But nowadays, something that's more mainstream and a lot less invasive is something called endovenous ablation. The way that endovenous vascular ablation works, it's actually very painful, okay? But the way it works is they inject a lot of anesthesia around the area. So they inject a high volume of anesthesia, something called tumescent anesthesia. It kind of actually helps elevate up the tissue a little bit. And then they take an ultrasound, find the vein, and use the ultrasound to help them guide a catheter, which is basically like a little tube, okay? They guide a catheter, and that catheter has a laser on it, okay? And they guide the catheter into the varicose vein, and they fire the laser off, and it literally ablates the vein, okay? I mean, it's pretty straightforward, but like I said, it can be very painful. Unlike sclerotherapy for spider veins, though, endovascular ablation, for the most part, you know, usually only needs to be done once. Occasionally it needs to be repeated, but unlike sclerotherapy, which you need about 5 treatments for the spider veins, for the little spider veins, endovascular ablation, usually 1, maybe 2 treatments that you have to go through. And as far as safety and potential side effects with endovascular ablation, because you are going in and essentially frying the interior of the varicose vein, you can develop a blood clot, okay? So that is one potential adverse side effect that can occur. So be aware of that. But for many people who are plagued by really dilated, those purple, prominent varicose veins, like on the outer thighs, for example, this can be something that can be very effective for that. I mean, varicose veins themselves are really hard to camouflage. Self-tanners don't particularly camouflage them well either. So they can be really hard to hide and really make people feel self-conscious about themselves. Like I've said in all of these cosmetic themed videos, while it's cosmetic, not covered by insurance, don't feel like it's not something that you deserve. If something is bothering you to the point where it is affecting your day-to-day function, how you feel about yourself, like it's keeping you from enjoying social things, keeping you from enjoying, vacations, really seriously talk to your treating physician about if it's right for you, because for some people it can really make a tremendous difference in how they feel about themselves, and they're elated by it. As far as the compression stockings though, like I said, if they're right for you, they can be preventative, and then if you pursue sclerotherapy, they are an imperative component of the aftercare. Compression stockings can either be knee high or thigh high, depending on what is right for you. And they're very difficult to put on. They're very uncomfortable for some. And some tips and things that you should know about them, if you've been advised to use them or you're using them, is that, as far as putting them on, I think most people feel like they can't get them on and that they don't fit. But in reality, that means that they actually fit if they're so tight that they're difficult to put on. If they're easy to get on, they're not helping. They're not really effective, probably. You should be fit for them if you really want the best ones. As far as caring for them, though, as far as caring for them and cleaning them, you never want to put them you never want to put them in the washing machine. You never want to put them in the dryer. The way to clean them is to just put them in a little bit of mild detergent, a little bit of mild, like delicate wash type detergent in a basin, and with a little bit of detergent to get out the sweat and oil from your skin, the dirt and grime, and then put them in some cool water to rinse that out. Don't wring them out. Don't hang them up. Definitely don't put them in a dryer. The reason you don't want to wring them out or hang them up is that if you hang them up, the gravity will stretch them, and it will start to compromise their squeezability. Okay, so it will just wear on the elastic and the elasticity and the compression of the compression stockings. So the better way to dry them is actually to lay them out on a towel and just let them air dry that way, or lay them out on like a drying rack, but don't hang them up. They also sell in a lot of the medical supply stores, and I'll see if they don't sell them on Amazon. They sell these special gloves that you can purchase to help you put them on, because they can be really hard, particularly if you have long nails, artificial nails. They can be really hard to put on. But they sell these special gloves that have these little tips on them. That are like little grippers that will help you to grip the compression stockings and pull them up a little bit more easily. They are very uncomfortable. Personally, however, I wear them during the day, and I love them, and even though they're uncomfortable and I hated them in the beginning, I'm kind of like really enamored with them. I feel like I have a lot more energy when I wear them because I just feel like my legs are not as tired at the end of the day. You guys know I work out at the end of the day. I go to the gym, and so I feel like my workouts are a lot you know, it's a lot better. I don't know if it's all in my head. I think I'm just having that little extra help from my friends to get blood back up to my heart during the day while I'm on my feet or sedentary at the computer working. It can really help, and it helps with I feel as though it helps my overall energy just to have that little added assistance in the circulation department. So while spider veins and varicose veins are fairly common, they can certainly be a source of cosmetic concern. I hope this video was helpful to you guys and kind of explaining why they happen, their prevention of them, and what can be done to treat them. If you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.